Welcome back to the deep dive. You know, we all go to the pharmacy,
Yeah.
but we don't always think about all the stuff that happens behind the scenes.
Right.
Like all those regulations and rules
Okay.
that actually are there to keep us safe when we get our medicine. So today, we are going deep into the standards of practice, straight from the Tennessee Board of Pharmacy.
Yeah.
And this is a document that is dated March 14th, 2024. So it is up to date.
Very cool. Very cool. It's interesting when I think about all these regulations, it really does impact everyone.
Yeah.
You know, even if you don't see them, they're kind of like working in the background.
It's kind of like...
Almost like the wiring in your house. You don't think about it, but, you know, if it's not working, nothing works.
Yeah, exactly. Exactly. So, okay, let's jump in. So this document starts out talking about responsibilities for pharmaceutical care, which sounds
pretty serious.
Pretty serious. So what's the big idea here?
Well, it really is like it lays the foundation for how pharmacists interact with patients.
Okay.
You know, and it's about making sure that you are getting the right medications, that you understand how to use them safely.
Right.
And effectively that you're getting all the information that you need. Yeah. You know, it goes way beyond like filling a bottle.
Okay.
And sending you on your way.
So it's more than like counting pills.
Exactly.
Okay, so I'm curious, like, in your career as a pharmacist, like, what's something that's happened that maybe you've seen that really showcases, like, how important this whole idea of pharmaceutical care is?
Well, I'll never forget, I had this one patient. She was prescribed a new medication for high blood pressure.
Okay.
And, you know, pretty straightforward, you would think. But during the consultation, she just casually mentioned, oh, yeah, and I'm also taking St. John's wort. And that's when, like, the alarm bells started going off because St. John's wort can interact with certain blood pressure medications and make them, you know, less effective or potentially dangerous.
Yeah.
And it was a detail. Yeah. She hadn't even thought to mention to her doctor.
Right. She didn't even think it was a big deal.
Right. It's an herbal supplement.
Right.
Natural, it can't hurt, you know.
Exactly. Exactly.
But, yeah, so that was a situation where, you know, it could have had real consequences for her health. But, you know, we were able to catch it.
That's pretty scary. It makes me think, you know, pharmacists are, like, really, like, detectives.
Yeah.
In a way.
Yeah.
Because they're having to think about all these different things that maybe the patient doesn't even realize it's important to tell their doctor.
Absolutely.
Yeah. So, okay. So this first section really focuses on face-to-face patient counseling. So tell me a little more about that.
Well, so ideally, you know, it is face-to-face. But there are, of course, some exceptions to that.
Correct.
Like if somebody, you know, has limited mobility or a parent picking up medications for their child.
Okay.
So then we would, you know, do it over the phone. But the point is that the pharmacist is making an effort to really connect with you, the patient, and provide all of this vital information.
Right.
They'll go over things like the name and description of the medication, you know, how and when to take it, potential side effects, things to watch out for, drug interactions.
So it's almost like they're a personal, like, medication guide.
Exactly.
Oh,
exactly.
Nice. Okay.
It's like a safety net.
I like that. That makes sense. So then that makes me think about something else I saw in here, which was this idea of patient profiling. So are they, like, keeping a file on me?
Well, in a way, yes. They do keep a record of your medication history.
Yeah.
But, you know, this isn't to be like Big Brother or anything like that.
Right.
It's really to make sure that they're providing you with the best care possible.
Right.
So, you know, they can check for interactions, see if you've had any problems with certain medications in the past. It's really just creating that safety net. But you do always have the right to refuse counseling.
Okay.
And to ask that they not keep a profile on you.
Okay, so it's really more like a tool to personalize the care.
Exactly.
Okay, that makes sense. So now, this is where I really got curious, this drug regimen review thing.
Right.
So what's going on with that?
Okay, so this is where the pharmacist really kind of puts on their detective hat.
Okay.
You know.
Okay.
And before dispensing your medications, they do a very thorough review of your profile. And they're looking for anything that might be like a red flag.
Okay.
You know.
Gotcha.
Are the dosages correct?
Okay.
Are there any potential drug interactions? is the medication the most appropriate choice?
Okay, so it's not just like a rubber stamp.
Oh, no.
Okay.
There's actual, like, analyzing going on.
Okay.
So, for example, let's say you're on a common blood thinner to prevent clots.
Okay.
And your doctor prescribes you a new antibiotic for an infection. Seems unrelated, right?
All right, yeah.
But the pharmacist knows that that specific antibiotic can actually amplify the effects of the blood thinner.
Oh, wow.
And, that could lead to a serious bleeding risk.
Okay.
So that's something that, as a patient, you may never even think about.
Yeah.
But the pharmacist can catch that and contact your doctor.
So they're like really advocating for you in a way.
Absolutely.
Wow, that's pretty powerful.
Yeah. And potentially life-saving,
Yeah, exactly. Okay, so that's like a lot going on already in that first section.
Yeah, a lot to think about.
Okay, so now let's move on to the next section. Medical and prescription orders. So now we're really getting into like those pieces of paper,
Right, all those rules about like
yes, all the specifics.
how we get those prescriptions, the information on the label.
Yeah, okay.
It might seem like a lot of technicalities.
Right.
But each of these rules really does have a purpose.
Right.
And usually it's tied to safety and accountability.
Okay, so here's something that really caught my eye. Pharmacists can only fill prescriptions in licensed, permanently located pharmacies.
Yes.
I never even thought about that. Like, why does it even matter where I get my prescriptions filled?
Well, this rule ensures that your prescriptions are being dispensed in a controlled environment that meets strict safety standards.
Yeah.
So it's really about protecting you from any potential, like, contamination, errors that could happen in, like, less regulated settings. You want to have that confidence that your medications are prepared correctly, stored appropriately. It's a big deal.
Right. Yeah, I never even thought about it that way. But that makes sense. It is a lot about trust.
Yeah.
Okay, so I always see them like dealing with all these numbers and files. Like, is that part of it too?
Oh, yeah. So that's the whole meticulousness of prescription numbering, filing, and record keeping.
Okay.
Might seem like overkill,
Yeah.
but it's all about accuracy and accountability.
Okay.
So these requirements help prevent errors.
Yeah.
They track every single prescription.
Okay.
And they help monitor controlled substances.
Right.
To prevent any kind of misuse.
So it's like every pill has a paper trail.
You got it.
Wow. Okay.
And it goes beyond just preventing errors.
Okay.
These records can help identify trends, potential issues that might otherwise go unnoticed. It's really about constant improvement.
Okay. That's good. That's good to hear.
Yeah.
It's not just about the rules. It's about making the system better.
Exactly.
Okay. So what about refills?
Refills, yes.
So, I know there's like limits and things like that, but why is it so specific about refills?
Well, again, it's all about safety and accountability.
Okay.
So they limit the time frame for refills and the number of refills that are allowed.
Right.
And this is to prevent any kind of like misuse, but also to make sure you're getting the follow-up care with your prescriber.
So it's not just about like convenience, it's about making sure that I still need it.
Exactly.
Okay, so speaking of things that, we kind of take for granted, what about those labels?
Yes.
They can be pretty confusing.
They can. But they're really designed to be as clear as possible and informative. And the rules specify exactly what information has to be there. So, things like your name, the prescriber's name, clear directions for use, and importantly, the date the prescription was filled and the expiration date.
Gotcha. So no more like guessing if this is still good.
Okay.
I've definitely done that.
Yeah.
Okay, so that's good to know. It's all about like transparency.
Yes.
Okay. And I know sometimes I have to transfer prescriptions between pharmacies. What's that process like? Why is it so regulated?
Well, it's more formal than you might think.
Okay.
Because the new pharmacy needs to record all the details from your original prescription. So that's like the original pharmacy's name.
Okay.
The prescription number, the remaining refills.
Right.
It's all about continuity of care and preventing any kind of mishaps.
Okay, so it's not just like handing over the bottle.
No.
What happens to the original prescription?
So the original prescription is actually considered void once it's transferred.
Oh, okay.
So
Gotcha.
to prevent any confusion, like double filling or anything like that.
Okay.
So the new pharmacy is the one that assumes the responsibility for keeping those records.
So it's like a relay race.
You got it.
Okay, so it's all about, like, making sure the medication gets to the right person and there's a chain of custody.
Accountability.
Okay, all right. So now let's talk about fax and electronic prescriptions.
Yes.
I'm surprised we're still using fax machines.
I know, it seems so old-fashioned, right?
Yeah.
But, they're still around. And especially in places where electronic systems aren't available, they're still a viable option.
Okay, so it's like a backup.
Yeah, a backup. And also for patient choice, Some people just prefer fax.
Okay. But what about security, though? Like, is that...
Yeah, that's a valid concern.
Yeah.
So the rules are very clear about security measures.
Okay.
So the fax has to come directly from the authorized prescriber.
Okay.
And the pharmacy has to verify it.
Okay.
So it's treated just like an original.
Okay, so it's just as official as a handwritten one.
Absolutely.
Okay. What about electronic ones? Like, are those secure? Because, with everything being digital now, it always makes me, like, a little worried about my data.
Right. Rightfully so.
Yeah.
Rightfully so. Well, the good news is that there are also safeguards in place for electronic prescriptions as well.
Okay.
Because we are dealing with sensitive health information.
Right.
So the focus is on ensuring that the transmission is secure and that there's no, misuse of that information. So they have to be sent directly from the prescriber to the pharmacist.
Gotcha.
No unauthorized access along the way.
Okay.
They use electronic signatures for authentication, just like we talked about with the paper ones.
So they've basically taken the security from the real world
and
put it into the digital world.
Exactly.
Okay, that makes sense. Are there other things in there, like, about security for those?
Yeah. So, for instance, the prescriber's phone number must be included for verification.
Okay.
And it has to clearly indicate the date and time of transmission.
Okay.
And also, going back to patient choice, the system can't restrict you to any specific pharmacy.
Okay. So I can still go wherever I want.
Absolutely. Absolutely.
Okay, good.
What else?
So one other thing I thought was interesting was that it actually prohibits any kind of, like, financial incentive for prescribers who transmit these orders. Yeah. So that, really helps prevent any conflicts of interest.
Right. And ensures that the decisions are based on what's best for the patient, not what's going to, put money in the prescriber's pocket.
Yeah, that makes sense. So, I mean, it seems like all this is really about, like, trying to make a system that's fair and ethical for everybody.
Yep.
Okay. So, we've been talking about, like, rules and procedures and all that, but, like, who is actually, like, responsible for making sure this happens? Like, who's the...
That's a great question.
The, like, overseer of all this?
So every pharmacy has a pharmacist-in-charge.
Okay.
And this section outlines all of their responsibilities. They're kind of like the captain of the ship.
Okay.
Making sure everything runs smoothly.
Yeah.
That it's compliant with all the regulations.
Okay, so what kinds of things, like, are they in charge of?
So, first and foremost, they are responsible for ensuring that all the pharmacy's activities comply with state and federal regulations.
Okay.
They're the guardians of all those meticulous records we've been talking about.
Right.
And even if the pharmacist in charge changes, there are notification requirements.
Oh, okay.
So the Board of Pharmacy always knows who's in charge.
So they're, like, keeping track of who's in charge.
Absolutely.
Okay, that makes sense. So, like, what other big things are on their list?
Okay, so another one that's really important is overseeing all the inventory procedures for controlled substances.
Right.
Those medications that have a higher potential for abuse.
Right.
Diversion. So there are a lot of extra security measures for that.
Okay, that makes sense. So tell me more about, like, what are some of the things that they have to do with the controlled substances?
Okay, so they have to make sure a detailed inventory of all those controlled substances is done regularly.
Okay.
And those records are kept, super secure, under lock and key.
Okay.
It's all about preventing theft and misuse.
Wow. That sounds like kind of high pressure.
Yeah. It's a lot of responsibility.
What if, like, something goes wrong? Like, what if, a patient is harmed by a medication?
Right. So they also have a responsibility to report any serious injury or death that may have resulted from a prescription.
Okay.
So, it's not an easy thing to do.
Right.
But it's necessary for transparency.
Right.
Accountability. And it helps identify any potential problems and hopefully prevent those tragedies from happening again.
So, I mean, it's a good reminder that mistakes can happen.
Yes.
But at least there's a system for addressing it.
Exactly, and learning from it.
Yeah. Okay, so basically all these rules are about making sure that there is a qualified pharmacist in charge
Yes.
overseeing everything.
Exactly. Making sure everything is done by the book.
Yeah, okay.
It's a multi-layered approach to safety.
Yeah.
And really, we've just scratched the surface.
Okay, I'm ready for more.
There's even more details in this document. Everything from like repackaging medications to handling outdated drugs to even the rise of automated dispensing devices.
Okay, now you've got me intrigued. I'm definitely ready to dive into those topics.
Welcome back to the deep dive. So let's, we see it every day at the pharmacy.
Yeah.
Repackaging.
Repackaging, okay.
You know those little blister packs of pills you get from the pharmacy? That's all repackaging.
Oh, okay.
And I have to admit, I've never really given those little packs much thought.
Yeah, me either.
Seems pretty straightforward, just, transferring pills from a big bottle to a smaller package.
Right, exactly.
But there are a whole set of regulations around this.
Oh, really?
Oh, yeah. And it's not just at your local pharmacy. It happens in, like, hospitals,
Okay.
long-term care facilities, where they might be dividing those bulk medications into individual doses.
Oh, okay.
So it's all about accuracy and safety, especially when you're dealing with multiple medications, maybe patients with complex needs.
I can see why that would need to be like really tightly regulated.
Oh, yeah, absolutely.
What are they like looking out for?
So pharmacist supervision, documentation, every step of the way.
Gotcha.
They're not just, tossing pills in a container. They have to make sure it's the right medication, right dosage, in the right package, labeling. It's just as strict as the original medication bottle.
Okay.
So it has to clearly state, the drug's name, the strengths, the lot number, the expiration date.
So it's like a little mini version of the full label.
Exactly.
Okay, that makes sense.
So, the patient has all the information they need, even if it's been repackaged.
Okay. What if I need to return a medication?
Oh, that's a great question.
Like, what if it's damaged?
Yeah.
Or I had, like, a reaction or something?
Yeah. So that's addressed in Rule 1147.3.10, which covers conditions for delivery or sale. It can get, a little technical.
Right.
But the main idea is that, yes, you can return a damaged medication, but it has to be done in a way that ensures safety.
So, like, I can't just throw those pills in the trash?
No, definitely not. Definitely not.
Yeah.
Improper disposal
Okay.
can have serious consequences.
Okay.
Think about the environmental impact.
Right.
Those chemicals ending up in the water. Or, what if a child finds those pills?
Right.
It can be dangerous.
Yeah.
So this rule really makes sure those medications are handled and destroyed in a safe way.
So it's all about those little actions and how they can have a bigger impact.
Exactly. It all connects.
Okay. What about medications that, like, have expired or gone bad or whatever? Like, I know we're supposed to get rid of those, but what happens to them at the pharmacy?
So that's covered in Rule 1140.003.11.
Okay.
Outdated and deteriorated drugs. Pharmacies can't just, leave those expired bottles hanging around.
Okay.
They have to either return them to the manufacturer or destroy them promptly and properly. And when it comes to those controlled substances, those meds that have higher risk of abuse, the rules are even stricter.
So they can't, like, throw away, like, old painkillers?
No. They actually have to be destroyed by a specific agent or vendor that's approved by the board.
Wow.
It's all about, that secure, accountable process.
So it's like nothing can fall through the cracks.
Exactly. So from the moment that medication comes into the pharmacy to the moment it's destroyed, they're keeping track of it.
Okay.
And speaking of those controlled substances, there are, rules about how they're stored, dispensed, even delivered.
Okay. So, like, break that down a little bit.
So first and foremost, security is key.
Okay.
Rule 1140.03.12 is very clear about that. They have to be kept in a secure area.
Okay.
Inaccessible to the public.
Gotcha.
So, think locked cabinets.
Right.
Safes.
Right.
It's all about preventing theft and misuse.
Yeah. I've always noticed, like, the pharmacy counter, there's, like, extra security there.
Right.
Okay. What about selling them?
Yes. So, when it comes to dispensing these controlled substances, the rules get really specific.
Okay.
So, for instance, there are some medications that aren't technically considered prescription drugs under federal law.
Okay.
But they can still be dispensed by a pharmacist.
Okay. Like what?
So think about, like, certain cough syrups that contain codeine.
Okay.
You don't need a prescription from a doctor for that.
Right.
But the pharmacist can only dispense it under very specific conditions.
Okay.
Strict compliance with those federal regulations.
So it's like they're trying to balance like making it accessible, but also...
Exactly. Controlling it.
Exactly. You got it. It's that balance.
Okay. So it's not just cough syrup. What else?
Well, another example is insulin.
Okay.
So it's a vital medication for people with diabetes, but it also requires very careful handling and dispensing. So like even though it's not a controlled substance in the same way like a painkiller is,
right,
it still
has those extra layers of like security and care.
Okay.
So the regulations, they require that insulin is stored securely, just like those controlled substances.
Okay.
And it can only be dispensed by a pharmacist or a pharmacy technician.
Okay.
Working under the direct supervision of a pharmacist.
So it's all about like making sure it's handled the right way.
Exactly.
Wow. It's interesting how like even for something we wouldn't think of as high risk, there's still all these extra precautions.
Yes, every detail matters. Now, you mentioned something earlier that really piqued my interest.
Yeah.
Automated dispensing devices.
Oh, yeah, those machines.
Yes.
Like vending machines for medication.
Exactly.
Okay.
And yes, the regulations address those as well in Rule 1140.03.13.
Okay, so tell me more about that. I've always wondered about those. Like, are they safe?
Yeah. That's a great question.
Efficient?
So safety is always the top priority.
Okay.
And that's reflected in the rules for these devices. So, there are procedures for how they're used, operated.
Okay.
For example, each medication's lot number has to be clearly displayed.
Okay.
The machine must be thoroughly cleaned
after
each use to prevent cross-contamination.
So it's not like just plug it in and let it go.
No. There's, oversight. So the pharmacist or pharmacy tech, under their supervision, have to load the machine, double-check everything.
So it's more like a tool for the pharmacist.
Exactly.
Not a replacement.
Exactly.
Okay.
It can definitely streamline things, improve efficiency.
Right.
But it's still that human expertise at the heart of it all.
It's like a partnership then.
Yes.
Okay. I like that. So we've seen a lot of changes in the pharmacy world, like with things like telepharmacy and centralized prescription processing. Are those things in these regulations?
They are. So, for example, Rule 1140.03.16 specifically addresses centralized prescription processing.
Okay.
So this is where, pharmacies can work together, even across state lines, to provide services like, filling and refilling prescriptions.
So like my prescription could be filled in a different state.
It's possible. It's becoming more common, especially with those larger pharmacy chains.
Wow.
But, there are strict requirements.
Okay.
So, both pharmacies have to be licensed in good standing.
Okay.
They need a secure system for sharing that info electronically.
Okay.
And they have to have a written agreement outlining each pharmacy's responsibilities.
So it's not like a free-for-all.
No, not at all.
Okay.
Still a lot of oversight.
Okay, that's good to hear. So it seems like a lot of these things are about like collaborating.
Collaboration, communication, you got it.
Okay. So, not just between pharmacies, but also between like pharmacists and like
doctors and
other healthcare providers. Yeah. Exactly.
Yeah.
And that actually brings us to our next topic, which is, really changing things up.
Okay.
Collaborative pharmacy practice.
I've heard about this.
Yeah.
This is where, like, pharmacists are more active in the care.
They are taking a more active role.
Okay. Tell me more.
So this is outlined in Rule 1140-3.17.
Okay.
And essentially, it allows pharmacists to collaborate with physicians, advanced practice nurses, physician assistants, to provide comprehensive medication management and patient care.
Okay. So it's a team effort.
A team effort. You got it. And it's all about, the patient's needs.
Okay.
So the rule really stresses the importance of having a formal collaborative pharmacy practice agreement.
Okay.
So it's a document that outlines the specific services the pharmacist can provide, how they'll communicate
with the other healthcare providers.
Okay.
And, of course, all the procedures for patient safety.
Okay, so that sounds pretty detailed.
It is.
Like, what kind of things can they do under that?
So it really depends on the specific agreement and the pharmacist's qualifications.
Okay.
But It could include things like conducting medication reviews,
Yeah.
making recommendations for, therapy adjustments,
Yeah.
even monitoring patients
Okay.
for medication effectiveness and side effects.
So they're kind of like
Yeah.
a partner in the care almost.
Exactly.
Not just the person who gives you the
That's the goal.
Okay.
To leverage their expertise to really enhance patient care and improve outcomes.
But the doctor is still ultimately responsible, right?
Absolutely. Absolutely. This is not about replacing the physician
Okay.
or the other prescriber's role.
Okay.
It's about enhancing it. It's about,
Okay.
working together, shared responsibility
Okay.
to get the best possible outcome.
So it's all about teamwork. And
Teamwork, communication, you got it.
putting the patient first.
Always the patient first.
Yeah.
And to make sure that this is working,
Yeah.
and that everyone is on the same page. There are also quality assessment reviews.
Oh, okay.
So they're constantly evaluating and
Right.
refining the process
Right.
to make sure it's
So it's not just like a one-time thing and then...
no. It's ongoing. It's continuous.
Okay. So they're always trying to make it better.
Always improving.
Okay, that's good. So before we move on, there's one more thing I wanted to talk about that kind of relates to this.
Okay.
And this is the provision of ivermectin.
Ah, yes. Ivermectin.
It's been in the news.
It has. And Tennessee's regulations have actually evolved to address this.
Okay.
So Rule 1140, 03.18
Okay.
specifically outlines how pharmacists can provide ivermectin to eligible individuals under a collaborative practice agreement.
Okay. So this is like not just filling a prescription from a doctor. This is the pharmacist can...
Right. So you don't need a traditional patient-specific prescription from a doctor.
Okay.
But you still have to meet certain criteria and go through a screening process with the pharmacist.
Okay. So, tell me more about that.
So the pharmacist will use a specific risk assessment tool to evaluate your eligibility for ivermectin. They'll look at your medical history, other meds you're taking, allergies, pregnancy, breastfeeding status. And they'll also provide you with a fact sheet that outlines important information about ivermectin. It's FDA-approved uses, potential side effects, drug interactions.
So it's not just like they hand you a pill and you go.
No. There's still a lot of counseling and education involved. So they want to make sure you understand the risks and benefits before you take it. They'll document the entire screening process, the medication dispensed, so it's all about accountability, transparency.
So it's interesting how these regulations, they have to kind of keep up with all these changes.
They're a living document, right?
Right.
Constantly evolving.
So it's all about patient access, but also keeping people safe.
That balance, yeah. You got it. So these regulations are really designed to be a living document, constantly evolving to keep pace with all these changes in healthcare and ensure that medications are handled responsibly.
Okay, so we've learned a lot.
We have.
In this deep dive so far. Who knew there was so much happening at the pharmacy?
Right. That's a whole world behind those counters.
Right. And it's all about keeping us safe.
Absolutely. And we've only just scratched the surface.
Okay, I'm ready for more.
There are even more fascinating details to uncover as we continue our exploration.
Welcome back to the deep dive. We've really gone through a lot of those regulations and kind of uncovered a whole world behind the scenes at the pharmacy.
It is amazing, all those details and how they all, work together to protect the patient.
Yeah, and it's all about safety, right?
Yes. Patient safety, that's the number one goal. It's like every little thing we've talked about, those labels, the counseling, all of it, points back to that.
Right. And we've seen how those prescriptions are handled so carefully.
Yes.
From the very beginning to the end when you get it. And how pharmacists are really
they're like watchdogs.
Yeah. They're really looking at everything, trying to catch errors and interactions.
Sure, nothing slips through the cracks.
Yeah, exactly. It's like a whole system that we don't even really see.
Right. And all those little parts.
Yeah.
They all work together.
Yeah, it's like a machine in a way.
Yeah, a well-oiled machine, hopefully.
Yeah, exactly. And that role of the pharmacist is changing too. We talked about collaborative pharmacy where they're working with the doctors more
directly.
Yeah.
Yeah, it's a
What do you think about that?
I think it's a really positive development.
Okay.
It shows that pharmacists are being recognized as like vital members of the healthcare team because, their knowledge of medications goes way beyond just dispensing.
Right.
They can really offer insights into those drug interactions, side effects, the bigger picture of how those meds impact your health.
It's like you've got a specialist, basically,
It's
in your trial.
medication specialist.
Yeah.
Okay.
Yeah.
So as we wrap up here,
yeah,
what's like the big takeaway?
The big takeaway, I would say, is that these regulations, they're not just about red tape.
Right.
They're really a commitment to protecting your health.
Okay.
Every rule, every procedure,
yeah,
it's all designed with the patient in mind. It's like behind the counter at the pharmacy, there's this whole system working to keep us safe.
Exactly.
Okay.
And it's a system that's always adapting to these new challenges in healthcare.
Yeah. Okay. So, we've talked about technology a lot.
We have.
We've got electronic prescriptions. We've got those machines that...
The robots.
Yeah.
Dispensing.
So what do you think, the future of pharmacy is?
That's the million-dollar question, isn't it?
Yeah.
I think technology is going to keep playing a bigger and bigger role.
Right.
But I really believe that human element is always going to be essential.
Okay.
Because pharmacists, they bring that knowledge, that compassion, that critical thinking. They can connect with patients, understand their needs, and provide that personalized care that, a machine just can't.
Yeah. A robot's not going to hold your hand.
Exactly.
Yes.
They might be able to count pills.
Right.
They can't replace that human connection.
Okay.
So I think going forward,
you're
going to see an emphasis on those skills, that pharmacists have, that communication, that relationship building, the patient advocacy.
So even though everything's getting so high tech, that human part is still going to be there.
I think so. I hope so.
Okay.
Because ultimately it's that human connection that really makes patients feel heard, understood, and empowered.
I like that.
Yeah.
Well, this has been a really amazing deep dive. I think I've learned a lot.
You do too.
About the world of pharmacy.
Yes. It's a fascinating world.
Yeah.
It really is.
And so to all of you listening out there, we encourage you to keep learning.
Keep learning. Stay curious.
There's so much information out there.
Absolutely.
Check out that full document.
Yeah, the full document.
From the Tennessee Board of Pharmacy, if you're really interested.
Yes.
And, always feel free to reach out to us with your questions and comments.
We love hearing from you.
Yes. So until next time.
Until next time.
Stay curious.